Welcome to HealthWatch, presented by Novant Health. I'm your host, June Baker. Our show features local physicians and health professionals discussing health topics of importance to local residents. Today, we will meet Dr. Stephen Nunns, who has recently joined Novant Health OBGYN. Then, we'll hear from Bobbie Carbonell, the manager of the Emergency Services Department at Novant Health Brunswick Medical Center. And finally, we'll learn more about the new tele-ICU capability at Novant Health via a virtual interview with Dr. Daniel Feinstein. Stay tuned to learn about valuable health topics with HealthWatch. First, let's welcome Dr. Stephen Nunns of Novant Health OBGYN. Welcome to the show today, Dr. Nunns.
Thank you very much for having me.
It's a pleasure to have you here, and I'm excited for our viewers and myself to get to know you a little bit better. So let's start with your background and your education. Where did you go to school?
Sure. So I completed undergrad at the University of North Carolina in Wilmington. Then I went over to Greenville to go to medical school at the Bobbie School of Medicine. And then I just finished up residency over in Wilmington once again at New Hanover.
We've gotten a lot of great doctors from New Hanover.
That we have.
We have. So you're a local boy then, right?
Yes, I was actually born and raised in Fort Bragg, Fayetteville area. Dad was in the Army, and I stayed here my whole life, and quite frankly, I intend to stay here the rest of my life.
And that is great news for Brunswick County. So you definitely had local connections, and that's why you chose this area, I'm sure, because you loved it.
Most definitely. I felt very comfortable with the patient population I was taking care of when I was at New Hanover, and I decided I wanted to continue to care for that same population throughout the rest of my career.
Oh, that's great. So I'm curious, and I always ask this of physicians, why did you choose OBGYN? Was there something that happened during your training that said, I want to deliver babies?
Well, actually, that's a great story, and I love to tell it. So before I was even in medical school, I got to be a part of a program for future doctors over at Bobbie School of Medicine, and I was given the opportunity to actually participate in a delivery, and that experience stayed with me throughout all of medical school, and I decided that's what I wanted to do for the rest of my life.
That's awesome. That is a very, very great story. So when did you join Novant Health?
I've been a member of Novant Health for now 3 weeks.
So you're
still
very,
early.
very, very new. Okay. Well, let's talk about your clinic a little bit and your partners. Who are your partners?
So I work with Dr. Richard Thompson, Dr. Richard Toller, and Dr. Nick Bodenheimer. And then I have Sarah Brown and Kia Fox as my midwife, nurse practitioner, and then Megan Childress is another nurse practitioner that's there.
Awesome. That is a great group. We've had all of them at one time on the show, and they always do a great job. And that's a fun group.
Oh, they're fantastic.
That's nice people. Such nice people. We really enjoy them. And you've got quite a few locations.
We sure do. Right now I'm primarily working at our Bolivia location, but we're also located in Leland, in South Brunswick, and in Southport.
Yeah, so you're kind of all over. It kind of takes care of all ends of the county.
That's the idea.
It makes it convenient for all patients. So, do you have any special interest in terms of OBGYN? Is there anything special that you like to do other than deliver babies? I know that.
Thank you. Oh, as a general OBGYN, I'd like to think that my interests are throughout all of the OBGYN care, but if I had to pinpoint one thing, I am very interested in minimally invasive surgeries. So we do a lot of work on the robot these days with excellent recovery for our patients, and it's something that I was passionate about in residency, and I think I'll continue that passion through my career.
Yeah, it seems like most of the younger doctors coming out, they're all familiar with the robot. They've all been trained on it from the get-go, whereas some of the older physicians or more experienced physicians, they had to go back and learn. And so nowadays it's kind of a given that when you come out of your residency, already trained in the robot.
It's an interesting dynamic, but the older physicians know a lot more about vaginal surgery. We come out knowing a little bit more about laparoscopy. So
And together.
Exactly. We can provide whatever kind of care the patient desires.
Yeah, that is good. I know this has been a unique time for you as well, but here with COVID-19 being on board, some of the patients have delayed care due to that. And what would you recommend to women who have put off their care, like an annual wellness visit?
My big recommendation would be know exactly what's going on with you, and then if you're at all concerned, please give us a call. We're happy to talk to you over the phone, decide if you need to come in, and if it's something that we can do over the phone through teleconference, televisits, or just telephone visits, we're happy to do that.
Yeah, but regardless, they should not put off wellness care.
I do not recommend putting off wellness care. We are working around Corona. I think Novant is doing a fantastic job, and we have things in place to make sure that you can continue getting the care you need.
Yeah. Are you asking pregnant women or women who are planning to become pregnant to take special precautions during this pandemic?
Well, for right now, we have increased testing in patients who come into the hospital. If they are pregnant, especially, you're going to get tested more. We are putting certain safeguards in place to make sure that our patients and our providers are taken care of, including we limit the number of visitors during a delivery to 1, and we usually ensure that people are wearing masks during delivery at the same time. We're social distancing appropriately, so this is okay.
Just like here, we have masks, but we're not wearing them currently because we are more than 6 feet apart.
That's correct.
And everybody in the studio has a mask on, so we're safe here.
Perfect.
Yeah. Let's talk a little bit about you personally. Do you have any hobbies?
Well, typically right now, I'm spending the majority of my time getting acclimated and making sure I'm doing a good job.
You're pretty busy right now.
Pretty busy, but while I was in college, I was actually part of the Ultimate Frisbee team, and I ran on the track team for a bit, so I like to maintain a pretty athletic lifestyle.
Yeah. So are you still a runner?
Not so much anymore, but right now I spend a lot more time in the gym or playing sports, tennis, those kinds of things.
But you like outdoor stuff.
I do, yes.
And you live near the water, right?
I was just about to say, like many people living in Wilmington, I happen to be a big fan of the beach.
Yeah. Well, it's a great place to live, and the lifestyle here is just so different. I find it invigorating, and there's just so much to do. But not only that, the weather's great, and so it's an awesome place. I'm so happy you've come to visit us today, and we wish you all the best. Before we wrap up, is there anything that you would like to add?
Not particularly. Thank you so much for having me. It's been fantastic joining the Novant Health team. It feels like it's home already, and I think I'll be here for a long time.
Great. Well, we're happy you're here too, and I'd love to have you back at a later date when you had more time in the practice, and talk about something specific that you'd like to talk about.
Most definitely. I'd be happy to come back.
Great. Thank you so much.
Thank you for having me.
Now, let's welcome Bobbie Carbonell of the Novant Health Brunswick Medical Center Emergency Department. Bobbie, thank you so much for coming today.
Good morning, June. Thank you very much for having me. It's an honor to be here.
Well, great. So to get us started, I'd like for you to share about your role with the emergency department at Novant Health Brunswick Medical Center. And before you start, I want to let everyone know that up until right now, we were masking, but because we're more than 6 feet apart, it's okay to do this, and everybody in the studio is masked except us.
Exactly.
So, all right, Bobbie, share that information with us about your role.
So I'm the emergency department manager, the nurse manager for Novant Brunswick Medical Center's emergency services. I've been there since February 2019, and I function in that role in the department and with our disaster planning and the pandemic planning and such as that.
And I understand you have a new assistant manager, is that correct?
I am very excited to say that Joe Hall has started with me as assistant nurse manager in the last month. He has actually been with Novant for
Really?
a year in the emergency department. and has been a nurse for 20, 25 years. So we're excited to have him on board. He's doing a great job, and due to social distancing, I am here today without him.
That's right. We were going to have him too,
Yes.
but we'd been too close together. So
Yeah, he's back at the house managing the functions.
until you get
everyday
right back
operations.
there, right? So I'm sure there are some viewers out there who haven't met you before. So tell me a little bit about your background and your education. How did you pick the emergency department, for instance?
So I've been a nurse about 25 years, and
Wow.
14 of those years have been in the emergency setting, disaster setting. I love the pace of the emergency department. I love that you get to see results usually right away, or we get to see the continuum of the care when they go upstairs. So that's pretty much what I've done the majority of my career. I've been in some other leadership roles operationally, but pretty much emergency departments since nursing school.
Where did you go to nursing school?
I started at Johnson Community College to get my ADN. I was a military wife, had 3 kids. So later in life, I went back and got my bachelor's. And then a little bit later, I finished my master's and ended up sitting for the boards to be a board-recognized nurse executive. So
Nice.
I just feel like the field is, especially in emergency services, you just have to continue to learn.
Right, yeah.
Things change so rapidly,
They
as we
change,
know.
Yeah. Well, I know that this has been an especially challenging year for you and your staff. And thank you for all that you do for your community. When no one else is working, the emergency department is definitely working. And I know that there's folks out there probably nervous about coming in to the emergency department because of the virus.
Right.
So tell me what patients can expect if they do present to the emergency department like right now.
So we're very careful about our sanitation practices, our protection, our personal protection equipment, and when our patients come in, we make sure they have masks on.
Right.
We take temperatures, we ask them the general questions, do you have a fever, have you been sick recently, and questions such as that. And we have an area in our lobby that we separate the known sick patients from something such as, I think I broke my foot on a skateboard accident,
Yeah.
so that we can protect all of our patients. We have an excellent, I have to manage them up, our environmental services, they're out of this world.
They are.
They work miracles to keep our all of our hospital on top of procedures and guidelines and making sure that everything is clean and up to par for the next patient. We do have specific procedures that we go through for the rooms to assure that they're ready for the next patient. They're down for a little bit of time, but we take every precaution possible to assure that not only our patients but our staff are safe, as team members are safe as well.
Yeah, so there are a number of precautions taken, both in the waiting areas and in the rooms themselves. Do the patients social distance in the waiting area?
We do, yes ma'am. We have our chairs marked off. They're taped off and marked off so that our patients are at least 6 foot apart. Those are wiped down frequently throughout the shift. A known positive patient goes into a specific area.
Okay.
And we have a HEPA filter in that room, so that's another process. We have 3 different processes in our lobby to assure that our patients can feel safe to come in, because ultimately the most important thing for our patients is that they come for treatment when they feel they need it.
Right, yeah, I know there for a while people were afraid to come and put off things a little too long and ended up with something more severe. So, let's switch gears a little bit. I know there's been another big change over the past couple of years with the addition of the NHRMC aircraft. So let's talk about the helicopter and like how often it's used and what a great resource that's been for us.
That is an excellent resource for our community here. We have such a positive collaboration process with them. They have actually been on campus, the chopper and the crew, since February of 2019. They started out at 12 hours a shift, but thank goodness we're so excited to say as of the first of this year, They're now on campus 24 hours a day.
24 hours. Wow.
So what that means for our STEMIs, our ST elevation MIs, in other words, heart attacks, our stroke patients, is that we can now, and since they've been on campus, get them back to our tertiary care center, which is New Hanover Regional Medical Center, within 18 to 20 minutes, which is amazing when you think about the drive. And I live in New Hanover County, so it could be anywhere from 35 to 50 minutes. So it's a tremendous resource for our community here. And we do a great job at Novant. We take care of our patients very, very well, but there are those patients that just have to go to a higher level of care, and they are there for us, and the collaboration process is in place, and it just works very smoothly. I think last month we transferred by flight, I want to say 9 or 10 patients, but since January it's just under 120 patients.
Wow.
That's tremendous for our community.
Yeah, and I understand that it also goes to the site if necessary of an accident or...
So we are not a trauma center. We do have traumas that walk in or they come in by private vehicle, but if we have a trauma, say a car accident in our community somewhere, they will land, or a fire, anything really that causes a trauma type accident for our patients, they literally can land the helicopter on scene, take the patient, and they're gone again in 18 minutes at, where they need to be to get the care they need.
So it looks like there's a significant amount of use for Airlink aircraft.
Yes, and with the growth in our area, we expect that to increase as well.
All right. Well, before we wrap up, Bobbie, what else would you like to add to our show today?
I think if there's one thing I could leave our community with is please do not hesitate to come to the emergency department if you have any symptoms. There are plenty of advertisements that tell you what to look for cardiac events, for stroke events. These are not situations you can sit at home and think about and let COVID get in the way of coming for care. So we are safe. We're going to take care of you. We're going to make sure that you're protected. Please just come.
So those are time-sensitive events, both heart and stroke. So time is of the essence. So the quicker they can get there, the better.
Absolutely.
And so they don't have to be fearful of COVID. Don't let that impact your decision. Just come to the hospital.
Yes, ma'am.
Okay, great. Well, Bobbie, I appreciate your time. I know how busy you are, and I know you have to get right back to the emergency department. Please give Joe our good wishes, and we're going to have him on at another time.
He will love that. Thank you so much for having us. It was a pleasure to talk to you.
You're quite welcome. Finally, we'll learn more about the new tele-ICU capability at Novant Health via a virtual interview with Dr. Daniel Feinstein. Dr. Feinstein is a critical care physician with Novant Health's tele-ICU program.
Nice to see you.
Nice to see you, June. Thanks for having me.
Thanks. I'm so happy you're with us today. And I understand that you're a critical care physician at Novant Health. So tell me what that means.
Yeah, June, I'm what's called an intensivist. As you said, a critical care physician. I'm currently at multiple Novant facilities. And a critical care doctor basically takes care of patients who have organ failures. A lot of those patients are on life support, of course, and mechanical ventilators, and other forms of life support like dialysis, and when patients are having trouble with blood pressure, and they come and meet the intensivist doctors, and that's what we do.
So you take care of the sickest of the sick.
Yeah, that's exactly it, and that's regardless of what that organ problem is. Whether it could be a pregnant patient, it could be a trauma patient, it could be a surgical patient, medical patients. They all come for us to help take care of them.
Right, that's great. Well, I've heard reports that there's a national shortage of critical care inpatient physicians. Is that correct?
Yeah, this national shortage it's not just the critical care physicians, it's critical care nurses as well.
Really?
And we've seen this coming along the way. Has a lot to do with our population growth,
Right.
and then how sick these patients are. The good news is we're keeping patients alive a lot longer. And the bad news is that, they do set them up for having infections and other significant health problems. And so Novant Health, we're doing our best to combat that shortage through means like of our new tele-ICU.
Mhm. Well, we're here today to talk about the new tele-ICU program that's now available here at Novant Health Brunswick Medical Center. So I'm curious, will the new telehealth ICU program help with that shortage?
Yeah, absolutely. You're spot on. We have a shortage of ICU doctors. We have a large number of our community hospitals that don't necessarily have those specialists on site. And
Right.
so, yeah, so we have our tele-ICU where we have our tele-ICU critical care specialists and nurses able to work directly with our bedside providers to provide that same high quality health care with the specialty care that those patients need right there in their community. So this will help reduce transfer of those patients because we have the specialty care that they need right in their backyard.
Right. How does the program work? Let's talk about that a little bit. I saw some pictures of carts, and I think they were made by one of the NASCAR groups there. Tell me about those carts and the purpose of those.
Yeah, the Edward Haas team combined and partnered with Novant to come up with those carts. They're about 6.5 feet tall. There's a camera at the very top connected to a computer screen and a computer. And they're small enough to kind of get in the room. The cameras are pretty amazing in terms of the focusing. So the providers at the bedside are able to work directly with our tele-physicians and tele-nurses who are obviously doing this remotely in Winston or Charlotte to manage patients together who are critically ill. We've pushed out, we're going to end up pushing out about 120 cameras. We're getting closer to that number. We've been able to install these cameras at Brunswick Medical Center. Actually, it was one of our first hospitals that we installed it at. Very excited about that, as well as Rowan Medical Center, as well as Matthews Medical Center, Huntersville, Thomasville, Kernersville, and Mint Hill. So these are all of our community hospitals that really are probably the most impacted by the physician intensivist shortage that you spoke about.
Yeah. So these will really impact and benefit patients at smaller community hospitals, correct?
Yeah, that's absolutely correct. Those smaller community hospitals, again, may not have that critical care specialist on the ground. And so we have our tele-intensivists then collaborating very nicely with our bedside providers. We do this anyway on a daily basis, and why not just do it remotely? It works out quite well.
Okay. Tell me about where these physicians are. Are they in a hub somewhere? Or are they in a hospital?
Yep, so great question. We have two bunkers. One is in our Charlotte area and one is in our Winston area. And in those bunkers, our larger bunkers in Charlotte, we have one physician who's a critical care specialist, and we're going to have 3 total nurses who are critical care specialists that are there. I want to just add on to one of the things you stated earlier. These patients now, they can stay in their community hospitals because these specialists are available. And we think we can reduce transfers close to 40%. And it's not just, so that's great, right? And it's not just the transfer is not safe sometimes for patients. It's certainly not a pleaser for patients. But we also know that this technology can reduce mortality, improve survivability by about 20%, and even shorten your stay in the intensive care unit probably by about 30%.
Mm-hmm. How about the nursing staff? Does this benefit the nursing staff also?
Yeah, absolutely. The nurses already, they're taxed to do a lot of things. And when you get a critically ill patient like this, as you can imagine, there's a lot to do. And so here we are, the tele-nurses can work directly with the bedside nurses. And in particular, we have a lot of alerts built in. We have the camera. So we're trying to also try to see, is there a patient declining? Is there something preventative that we can do to improve their outcomes? So those extra eyes, extra ears, as you can imagine, would also help out with their outcome.
Mm-hmm. This might be a stupid question, and I apologize if it is, but do you like round on the patients?
Yeah, very, very good question. So we certainly handle acute changes in their status, right? But yes, our tele-team rounds, just like we're in the room, we go through the labs, we go through the imaging, we talk to providers, we talk to nurses, we talk to families.
That's awesome.
Yeah, so we round just like we were at the bedside.
Wow, that is amazing. So the family can be included in this treatment plan and what have you.
Yeah, absolutely. That's what we want. And it's amazing how receptive our family members are. I think they see the value. They love their bedside providers. Yeah, but they also say, here's some extra eyes and ears and who are going to help my loved one.
Yeah, well, I can tell you here, the folks in Brunswick County love to stay local. They want to stay in our facility as long as possible. And I think this is going to help them do that. And I think when the patient's families see how beneficial it is, they're going to love this program.
Yeah, no, and you don't have to tell me that because I'm already rounding on patients there in Brunswick Medical Center, and they love their hospital and they want to stay. And I can already see that their love for community and they're more comfortable there.
They're very invested in us and they love our facilities. So this is going to be great for them. In this COVID-19 environment, will this be helpful and benefit those patients?
Yeah, absolutely. So this is going to benefit both COVID-19 patients, which it already has. We certainly have had, I think, an impact there, and also the non-COVID critically ill patients. Both of these patient groups are going to be benefited by the tele-ICU program.
How about success stories? Do you have a lot of success stories to tell?
Yeah, we have. And in fact, to be honest, I think some of our biggest success stories have come from Brunswick Medical Center.
Really?
Yeah, we've had several COVID patients who were so sick that even transfer would have been way too dangerous. They were on mechanical ventilation, some not on mechanical ventilation, but our critical care specialists were able to really help out our bedside providers with the mechanical ventilator machine and some of these, pretty complicated drugs and therapies that we're offering our patients. We've had patients very sick for weeks actually at Brunswick who we helped out, who actually walked out of the hospital, was very sick with COVID. Yeah, it's pretty remarkable. We've had a very sick patient who did not have COVID, had high blood pressure in the lungs, very complicated cardiac status, using a lot of very complicated drips of medications for the heart, and we participated in that patient's care as well, and she did well. So it's been really rewarding to see the benefit.
That's awesome. Well, this has been a great interview with you. I have so many other questions. I'm hoping I can reach out to you again and have you back on.
Yeah, I'd love to join you again. It's a great community, truly, and I think that what we put together with the tele-ICU is just amazing and remarkable care.
It is. Well, again, thank you so much for taking time out of your busy day. I know how busy you are, and we so appreciate your time.
Thank you, June. You enjoy that weather out there.
You have a great day.
You too.
Thank you for tuning in to ATMC TV's HealthWatch. I hope this information was beneficial for you and your family. If you have any questions or topics that you would like to see discussed on a future show, please email them to atmctv@atmc.com. Visit novonthealth.org for more information on Novant Health Brunswick Medical Center, local doctors, and general health information. Thanks again for joining us today. Be sure to join us next time for HealthWatch on ATMC TV.
Getting an alert the kids made it home safely or need to let guests in when you're not there. That's ATMC Security. And then there's the time when having professionally monitored smart home security really matters. ATMC Security offers remote access, real-time alerts, video monitoring, and interactive security, keeping you connected to your home from wherever you are. Start with 24/7 emergency monitoring for burglary, smoke, fire, and carbon monoxide for as low as $17.95 per month. ATMC Security. Safeguard your home.
At ATMC, it's all about you. Yes, you. Build your own bundle at atmc.com and get faster speeds, more choices, and bigger savings. Like faster internet with speeds up to 1 gigabit, which makes streaming ATMC's Merge TV a breeze. You can even control your lights and locks from anywhere and save big on home phone and wireless. See? It's all about you. Build your bundle today with ATMC.